Breathing exercises. The first one is diaphragmatic breathing. Benefits of diaphragmatic breathing include it improves ventilation, mobilizes lung secretions during postural drainage. Procedure. Patient lies in a gravity assisted position, that is the semi-Fowler's position. If the patient makes use of the accessory muscles like the sternocleidomastoid, then teach the patient to relax, that is shoulder rolls can be coupled with relaxation. Place the hand on the rectus abdominis muscle, breathe in deeply through the nose for about 3 to 4 times and then rest. If the patient has difficulty using the diaphragm, teach the patient sniffing action to activate the diaphragm. Progress further either in supine, sitting, standing position or while performing any other activities. The second one is segmental breathing. Indications are hypoventilation, for example in case of chest wall fibrosis, atelectasis which is lung collapse, and pneumonia. The first type under segmental breathing is lateral coastal expansion. This is either done unilaterally or bilaterally. It facilitates the lower rib cage expansion. Indications in case of asthma, emphysema, bronchitis. Procedure for lateral coastal expansion. Patient is in a sitting or a hook lying position. Therapist's hands are on the lateral aspect of the lower ribs. At the end of exhalation, apply a downward and an inward stretch to the chest wall. This facilitates external intercostal muscles. The patient may also do this independently or apply resistance using a towel or a belt. Second one under segmental breathing is posterior basal expansion. Indications: used for patients who are confined in prolonged semi-reclining position, which results in accumulation of secretions in the posterior segments of the lower lobes of the lung. Procedure includes patient lies in a sitting position and leaned forwards on a pillow with the hips slightly bent, as can be seen in the stick diagram. Place the hands on the posterior aspect of the lower ribs. This is done by the therapist. Same procedure is to be followed. That is, at the end of exhalation, the therapist is going to apply a downward and an inward stretch. Then we have the right middle lobe or the lingual expansion. Procedure includes patient lies in a sitting position. Therapist's hands are placed at the right or the left side of the chest, below the axilla. The third type of breathing exercise is pursed lip breathing. Benefits: decreases the respiratory rate, decreases tidal volume, improves the exercise tolerance. Procedure for pursed lip breathing. The patient should be relaxed. No contraction of the abdominal muscles should occur during expiration, since expiration is a passive process. Place one hand on the abdominal muscles to make sure that there is no contraction of abdominals during expiration. Next, the fourth one is how to prevent and relieve episodes of dyspnea. Procedure includes patient should sit or stand in a relaxed forward bent posture. Perform pursed lip breathing. The benefits include the forward bent posture stimulates diaphragmatic breathing. The fifth technique under breathing exercises is coughing. So how to teach the patient an effective cough? Procedure includes place the patient in a relaxed position, sitting or leaning forwards. Leaning forwards is considered as the best position for coughing. That is, as can be seen in the diagram. Teach the patient diaphragmatic breathing, that is deep inspiration. Place the patient's hand on the abdomen and ask them to make 3 huffs. Huff is done against open glottis. Now ask the patient to perform K sound. Now deep inspiration followed by a sharp double cough. Cough is produced against a closed glottis. The second cough is the more effective one. If the patient cannot produce an effective cough, make use of abdominal binders or glossopharyngeal breathing. The sixth technique is incentive spirometry. Benefits: it prevents atelectasis, that is lung collapse, improves the strength of the inspiratory muscles, increases the lung volume. Procedure: place the patient in a semi-Fowler's position, inhale 3 to 4 slow breaths, maximally exhale the fourth breath. Inhale through the spirometer and hold the balls for about 3 to 4 seconds. This can be done for about 5 to 10 times, several times a day, or 15 times after every 2 hours. A few precautions to be followed in breathing exercises. Never allow the patient to suck air by gasping. Avoid uncontrolled coughing spasms, that is paroxysmal coughing. Avoid forceful coughing in patients with CVA, stroke, or aneurysms. Instead, encourage huffing, as the ICP, that is the intracranial pressure, is already increased. To avoid further increase, avoid coughing and encourage huffing. Be sure that the patient coughs in somewhat erect or a side-lying posture.